Due to the nature of the biopsychosocial model of pain, it's clear that the mind and body are not separated but share a connection, with each one influencing the other. However, historically we've tried to separate the two when managing or treating chronic pain, which has led to a poor understanding and management of these presentations. So in this video, I'm going to let you know how chronic stress and trauma influence the functioning of our brain and nervous system, resulting in physical changes to various body systems, causing them to become sensitized, overprotective, and unhelpful. Hey friends, Mahin here. In conditions like fibromyalgia, chronic widespread pain, or multi-joint osteoarthritis, the persistence of pain means that the fight, flight, freeze response is constantly active. This causes this response to become super efficient, whilst at the same time increasing the stress on multiple body systems, such as our nervous, immune, and hormonal systems. So today I'm going to let you know the link between stress, trauma, and developing chronic pain. So let's get into it. When considering chronic stress, we need to take into account the social element of the biopsychosocial model and the influence adverse childhood experiences, otherwise known as ACEs, and developmental trauma have in forming our neural networks and immune system. We now know that if someone's exposed to significant stress on their nervous or immune systems in childhood, then there is a greater risk of developing chronic pain or other long-term conditions such as diabetes or heart conditions in adulthood. Many chronic pain services now recognize the strong link between pain and also previous trauma and chronic stress, which helps us to identify strategies that might be helpful. This is called a trauma-informed approach. And trauma can be classified as big trauma or small trauma. Big trauma includes physical abuse, sexual abuse, emotional abuse, neglect, and family dysfunction. In the ACE study, it was found that people who experienced 4 or more such experiences were more likely to develop chronic pain or other long-term conditions, such as obesity, high blood pressure, heart conditions, and arthritis, just to name a few. As adults, individuals who experienced childhood trauma reported more intense chronic pain, migraines, stomach pains, respiratory, gynecological, and neurological symptoms. Small trauma includes bullying, looking after children with health issues, car accidents, poverty, and work stress, again amongst many others. And when people go on to experience these types of trauma in adulthood, the likelihood of developing chronic pain increases. Something I noticed very early on in my career is the strong link between past trauma, abuse, and chronic pain, especially for my patients with chronic primary pain conditions like fibromyalgia or chronic widespread pain that is nociplastic in nature. The vagus nerve is the longest nerve of the autonomic nervous system, connecting our brain to the rest of our body. It has links to our heart, our digestive system, and our immune systems. Our gut is known as our second brain, and the gut-brain axis refers to the connection between the brain and central nervous system to the intestinal nervous system. The vagus nerve is the main nerve linking both these brains together. Bacteria in the gut influences the nervous and immune systems, and information that travels up through the vagus nerve to the brain can influence mood and anxiety. It's this new knowledge that shows a relationship between our diet and our mental health. You may have also experienced this gut-brain link yourself when you think about that gut feeling or the butterflies in your stomach that you get when you're nervous. The vagus nerve is an important connection between various neurological, inflammatory, and psychiatric conditions, and it's thought to have 2 branches. Firstly, the dorsal vagus nerve branch, which looks after the function of the intestine and lower limbs, and then you have the ventral vagus nerve branch, which looks after the facial muscles and the heart. Within polyvagal theory, a normal state is when the ventral branch is active and dominant. When we're aroused by actual or perceived threat, whether this is chronic stress or past trauma, our sympathetic nervous system, or our fight-flight response, is activated in order to protect us. However, if the perceived danger is too high and the chance of safety is very low, then the dorsal branch of the vagus nerve is activated, leading to a low arousal state, depression, and, at its extreme, a freeze or fall response when we actually faint or dissociate. If someone's been in pain for a long time and there's associated stress, trauma, anxiety, and depression alongside that, it's very likely that their system is dominated by the dorsal branch or the sympathetic nervous system. And once this fight or flight reaction occurs, it can take much longer for the body to come back to its pre-fight or flight state. Moving from a fight or flight state back to normal can be done in many ways, but ultimately there needs to be more of a sense of safety rather than danger. Understanding polyvagal theory and the factors that lead to the activation of the dorsal branch has helped me understand why so many of my patients present with anxiety, depression, and past trauma, alongside IBS, pelvic pain, and lower back pain, even when scan findings return not showing an explanation for these. When we experience stress, our hypothalamus, pituitary, adrenal axes, try saying that 10 times, and the sympathetic nervous system release adrenaline and cortisol in response to threats that either come from internally within our body or our external environment. Whilst this is helpful and protective in the short term, chronic ongoing stress can lead to long-term problems with our endocrine and neuroimmune systems. Both acute stress, whether this is being involved in a car accident, surgery, or a fight with your partner, or chronic stress, whether this is looking after an unwell member of your family, childhood trauma, or living with a chronic illness yourself, all cause increased inflammation in the body. This can sometimes be picked up in a blood test, but more often than not, this inflammation is happening within the brain and it can't be picked up on a scan or a blood test. With chronic stress, like adverse childhood experiences, the microglia, which are a type of glial cell in the brain, are more readily prepared for activation. This means that an otherwise minor stressor can cause complete microglia activation, creating neural inflammation and collateral damage to the neighboring neurons and synapses. This, along with persistent high cortisol levels, changes various nerve circuits in the brain, leading to inflammation in the immune system of the brain and spinal cord, and elevation of pain and mood disorders. It's also important to note that drugs like opioids can also increase this microglial activation. There's now also newer research suggesting that gliopathy, which is a dysregulation of the brain's glial cells, is the main issue in chronic pain and central sensitization. Therefore, reducing this inflammatory response to stress can lead to a pain reduction. As I mentioned at the beginning of this video, medication is often not the answer for this, and a more holistic approach is needed. To learn more about the most effective ways to reduce stress and pain if you're living with it yourself, check out my Living with Pain playlist next. Otherwise, if you're a health professional, check out my Do Your Patients Have Pain playlist next for ways to help your patients reduce their stress and pain. Thanks for watching, have a lovely day, and I'll see you on the next video.